Which of the following is least likely to impair fracture healing? That means which improves the healing of the fracture. The options are radiotherapy, osteoporosis, administration of NSAID, preservation of the periosteum, and preservation of the osteomyelitic sequestra. So the impairment of the bone healing occurs by different substances or different pathological condition or different type of the factor, but we have to find out in which there is no chance of impair bone healing. So first of all, let's see the factor affecting the fracture healing. And let's see, this is the two end of the bone, such as this is one part of the bone, then there is the another part of the bone. So normally what happens, these two bones usually join with each other and finally fracture healing occur. First of all, let's see the age, that means extreme of the age, that means in case of the smaller group and in case of the older group, these two group has the risk factor for delayed fracture healing. Also the malnutrition, that means a patient who is deficient from the different type of protein substances, different type of the collagen, mineral, vitamin, in this condition fracture healing will be affected. Also the bones disorder, which is the osteoporosis. In case of the osteoporosis, there is the less amount of calcium, less amount of the phosphate, so the healing procedure hampered. The systemic disorder, certain systemic disorders such as the diabetes, we know the diabetes is the father of all disease, so in case of the diabetes, bone healing impaired. Marfan syndrome, Ehlers-Danlos syndrome, actually they are the abnormalities of the collagen and also the abnormal musculoskeletal healing. Drugs such as the steroid and NSAID, the steroid drug and NSAID drug, they also reduce the healing. Types of the bone such as the cancellous or spongy bone fracture are usually more stable and involve greater surface area and have a better blood supply than the cortical bone. So the spongy bone, they heals rapidly, but the cortical bone, they are the less rapid regarding the spongy bone. Also degree of trauma, that means when there is more force of the trauma or there is a severe form of trauma, in this condition the fracture healing reduce. Vascular injury, especially the femoral head, talus and scaphoid. So what happens when there is a vascular injury occurs? So in this condition, AVN, that means the avascular necrosis occurs, especially in the femoral head, talus and scaphoid bones. The degree of the immobilization, that means there is the more time immobilization, it affects bone healing. Intra-articular fracture, so in case of the intra-articular fracture, usually it delayed healing. So what happens in case of the intra-articular fracture? Let's see, this is the fracture which involves the articular area. So what happens for the bone healing? First of all, there should be a hematoma formation. So when the hematoma formation, what occurs in the articular surface, there are fluid, that means the synovial fluid. So the synovial fluid wants to washes out this hematoma. So as the washes out of the hematoma, which is the initial stage of the fracture healing, so in this condition it will be reduced. Also infection is another important cause. Infection is really disaster. Infection is the main headache for the orthopedic surgeon, that it reduces bone healing. And periosteum preservation, we know the bone gets blood supply also from the periosteum, and it is the outer covering of the bone, and it is very helpful for the healing of the bones. So the periosteum, if periosteum present in this condition, fracture of the heel is very rapid. So which is least associated with impaired bone fracture? It is the preservation of the periosteum. That means when there is preservation of the periosteum, in this condition bone cell healing is very rapid. Other option here such as the radiotherapy. What does the radiotherapy? It kills this bone cell, it destroys the bone cell. So as it destroys the bone cell, so there is less healing. Osteoporosis, in case of osteoporosis, there is less calcium, less phosphate, so no bone formation or reduced bone formation. Administration of the NSAID, that means the non-steroidal anti-inflammatory drug, it blocks the prostaglandin. And presence of the osteomyelitic sequester. This sequester is a dead piece of the bone. So any dead foreign body present in the fracture area, it reduces the healing rate.